All right, welcome everyone to the CCDPH School Health Meeting for October. We'll get started. Seems that we're at a quorum. We have most folks that plan on joining us join. Those who are not here yet, they can fold in too. Starting with a welcome. I know a lot of you who are on this meeting, they are familiar faces. You have been here a while, but we do also have some new folks who this is their first time joining the school health meeting. So what is the school health meeting? Our meeting is a community of learning, and it's where administrators and staff from the schools come together along with daycares that are in suburban Cook County. And what we do is we talk about the latest guidance on preventing the spread of infection diseases. We receive valuable resources and tools that we share amongst our learning community. And then we also discuss some everyday strategies that we can use within our schools and within our homes to ensure that we keep our staff, students, and families healthy. So a couple of objectives for this meeting. All right, just to stay informed, we're getting the most up-to-date information. We're sharing resources amongst our learning community and also providing support. We have a lot of staff and administrators that share the same roles at various schools and school districts. So it's an opportunity for you to connect with someone that shares a similar role or same role or a different role to be able to share and connect and discuss best practices. Next slide. You know what? All right, couple of housekeeping. Please let us know if there are any specific access needs. So if you need us to turn on transcription, please let us know. We ask during this meeting that you keep your line muted. And then also, as we're going through the slides, we're going to have presenters from various organizations. Please feel free to type your questions in the chat. As you type your questions in the chat, we have Stacy, who's joining us as our tech assistant today. She'll be answering questions, or our presenters. They'll be looking through the chat if you have a question for them in regards to their presentation to answer those questions. But we also have an opportunity at the end of this presentation today to ask any questions that you have. Also, all webinars are being recorded. The good thing about that is they're going to be uploaded to our website and our YouTube page. So if you have to leave early or maybe one of your colleagues was unable to join, these will be accessible through our website as well as our YouTube page.
I just had to get on here. Wouldn't let me on. They just let me in.
For our agenda today, we have a pretty jam-packed agenda. So thank you to our speakers who are coming through today to bring us the information. So this is just a high-level overview of our agenda. I won't go over it, but just give you guys a sneak peek. So we'll be moving pretty quickly.
Thank you so much. Perfect. Thank you.
I'm going to request that as you're joining, if you can please mute your mic for me. And Stacy, as folks are coming in, can you mute folks as they join as well? All right, announcements. First announcements. Who am I? Why am I speaking to you all today? Not Kelly. Well, Kelly is on leave and won't be returning until February. So in the interim, myself, I'm Alicia Boyd. I am the Director of Community Engagement and Health Education at the Cook County Department of Public Health. Today I'm joined by Stacy Spence-Digg. She is going to provide our tech assistance today. So she's on the line. She will also be another interim facilitator over the next couple of months. So you'll be seeing her. And then also Miss Marcia McCullough. You'll be seeing her, which a lot of you, if you're some OGs who've been in the school health meeting, you already know who Miss Marcia McCullough is because she used to host the school health meeting. Also, last month, Kelly mentioned a new CCDPH SharePoint site. We will be temporarily using that. So over the next month, it may go away because what we're going to do, we found the easier way to just update our school health website, which is accessible by any web browser. We're going to update that, and that's going to be our new form of communication. So no longer will you receive the long emails with the resources. you'll be able just use the link to our school health webpage and
Is that going
access
to
all the
bother you, Cindy? We
recordings
both.
and webpage. And then lastly,
Are we
there
going to echo?
be no meeting in December because our meeting in December was around your Christmas holiday break. So what we decided to do was to cancel that meeting, and we will launch our new school health newsletter. So it would not replace the meeting, but that would be our first newsletter that we will send in lieu of the meeting in December. So this meeting every month, again, it's an opportunity for us to share resources and share the latest guidance. And then we also regularly have speakers that come and share resources. And this information is gathered by you all. So you all determine the topics that you want to hear for these meetings. And last year we launched this survey to get your feedbacks on topics that you want to hear. And so this is another opportunity for you to provide any feedback on any topics that you want us to cover through our. This survey will be open until November 30th. This is just a list of CCDPH contacts. This will be accessible on this presentation, so please feel free to revisit and you can get access to the CCDPH important contact. Again, as folks are coming, ask that you mute yourself. I am hearing feedback from a couple of folks. And Stacy, as they come in, if you see folks that are unmuted, can you please mute them for me? Thank you. For any naloxone requests, you can get this through Denise Holman, which is our opioid health educator in our community behavior health unit. You can request naloxone for law enforcement agencies, community-based organizations, and individuals can request naloxone through this website. Last month, you heard from our regional health officer. We launched in collaboration with the Alliance for Health Equity, the community input survey. This has been extended into October 31st. And so we are looking for representation from our suburban Cook County and the South Side, and also the Southwest suburbs. So please feel free to take this, share this with your community residents and your family to take this survey. Remember that this survey gives us insight into the community health needs and the priority of the communities that you live and work in. And it also informs CCDPH's community health improvement plan for suburban Cook County. So it's an opportunity to uplift your voice. We are also, our epidemiology unit will be conducting the 2024 Youth Behavior Risk Survey. This was launched or will be launched starting October 21st. 28 schools was randomly selected. All schools received the FedEx package to complete this survey. If your school has received this package, we ask that you complete the survey and then please send it back as soon as possible. If you have any questions regarding the survey, please call this number. Our resources that we have. We are happy to announce that we'll be launching starting this Saturday, October 19th. We'll have a free COVID-19 and flu vaccination clinics that will be running on most Saturdays from starting this Saturday until February 22nd from 8 to 4 p.m. Walk-ins are welcome, so there are no appointments necessary. We will have our community health promoters, which are equivalent to community health workers there, providing resource coordination. Only thing that we require you to bring is some form of ID. A person's immigration status will not prevent them from getting a vaccination. And these clinics will run for the next few months in these clinics. So we have 5 clinics across suburban Cook County here. Just in case you like the visual, this is just our flyer for the upcoming Saturday clinic for the free vaccinations. October is also National Bullying Prevention Month. So this is a resource from stopbullying.gov. This is a great resources to share with teachers and also students. They have educational videos, tools, and resources that will be beneficial for students and teachers. Martha's have a positive youth development program for youth from the ages of 12 to 17. So this is a resource to share with students and your family who's interested in positive youth development programming. Illinois School can access varsity tutors, no-cost platforms to support their students in their educational journey. And then also the Adolescent Suicide Postvention Resource Hub is an opportunity for students and teachers to share resources with students and families to help navigate the grieving process of suicide. And on this website, you can get access again to tools and resources. The great thing about this website is if you are unfamiliar and don't know how to navigate this website, you can request the Care Navigator to help you find appropriate resources. Or if you're do-it-yourself, you can browse through these resources on your own. ISB is offering breakfast after the Bell Grant. So schools are able to receive award up to $7,000. So this is available to school districts, charter schools, regional offices of education. They're eligible as long as they're approved to operate the federal school nutrition program. And the Illinois Breakfast After the Bell grant program supports implementation of breakfast after the bell service models in schools to make breakfast more accessible to students. The 2024 Clean School Bus rebate is available through the EPA. And this is to benefit schools that meet one or more community prioritization criteria by providing a grant to existing schools, to replace existing school buses with clean and zero emission models. So the website is here. If you're interested in learning more information, please visit the website. But take note also that they are going to be hosting, the EPA will be hosting webinars for you to join and ask questions from October through December. Few events. The Quinn Center in Maywood will be hosting a Fall Fest. That is to take place Friday, October 25th. Aunt Martha's is hosting a parent support series. They have 4 in-person options as well as 2 Zoom options. I believe there's only 1 Zoom option that's going to be happening. Feel free to scan a QR code or visit their website. And then also Aunt Martha's will be hosting the Autumn Zen Bath for health and wellness. And then this one is around the corner. So this is in the upcoming Tuesday. So the Social Emotional Learning Alliance in the US, they're going to be hosting a virtual resource showcase. It is free. And what it is teachers can join to discover new approaches to strengthen and enhance social and emotional learning in their school or school district. So this is an opportunity to sharpen your skills in SEL and gain resources. Please register. It does happen this coming Tuesday, October 22nd. All right, so this brings us to our first presenter from our communicable disease. And we have Miss Michelle who's joining us. Michelle, take it away. Or would it be, I'm sorry, Michelle, would it be you or Sheila today?
Hi, Alicia. This is Sheila. I'll go ahead and present my update to keep us moving along.
Perfect.
Can you hear me? Oh,
Sheila.
sure, no
Yes,
problem.
we can hear you fine. Thank you.
Okay, I am sharing my screen. Please let me know when you can see it. Is it visible? Hi, can you guys
Alicia,
see
you're
my screen?
muted. No, we can't see anything.
Okay, thank you for that. Hold on, let me go back out. Go back on. Okay, what about now?
We're still not seeing it now. Sheila, at the very top of your screen, do you see anything that says take control?
No, I do not. All I see is present, but hold on, let me check again.
Mhm. It's here. We see it.
Okay, great, wonderful. So thank you, Alicia, for that information. Very, very well, great information for our community. And a warm welcome to all, and of course, those that are joining new for the first time. My name is Sheila Giovanni, and I take this opportunity to use this platform to provide our communication updates on any new information that we feel will be beneficial to you. So, in our last meeting, I provided a presentation to forewarn you about the uptick of cases for pertussis, and letting you know that you should and you will be receiving more and more pertussis cases within the school environment. So I do want to continue on that, but I want to provide the transmission aspects as well as provide you with information on our outbreak definition. So pertussis, also known as whooping cough, it is characterized by its coughing fits, oftentimes very violent. It's very contagious. It's a bacteria infection that spreads through respiratory droplets. As noted, the number of cases are increasing, with the current number of pertussis cases nationally being 5 times higher than the former year. So, what normally takes place is after being exposed to a confirmed case of pertussis, symptoms typically develop within 5 to 10 days. But the incubation period, it can be as long as 21 days. It's important to note that a single case of pertussis should be reported to us as soon as possible, but ideally within 3 days. Our outbreak definition is defined as 5 or more cases clustered in time within 42 days of each other that are epidemiology linked. And this does exclude non household members. So, currently here in suburban Cook County, our local health department has logged 3 pertussis outbreaks within schools so far. So, of course, pertussis is preventable and vaccination is the key. Childhood vaccination series is completed with DTaP vaccination during early childhood, with 2 doses. I'm sorry, with doses starting as early as 2 months, 2 for 6 months, and then again between 15 to 18 months. And starting at 4 to 6 years of age, will complete your fifth dose. A booster is required for normally the ages of 9 to 10, as well as for adults. Adults require a booster every 10 years. So this is a great opportunity to ask yourself, have you received your adult booster? If not, you should look at, in this climate that we're in with the uptick of cases for pertussis, it's a great time to reach out to your primary care provider and schedule that appointment for that pertussis booster, because recent data indicates only 44% of adults, meaning 18 and older, have received their booster. Another preventive strategy, of course, is hand hygiene. I would be remiss if I didn't mention the importance of making sure that we are staying on top of washing our hands often and frequently throughout the day. as well as masking. Masking is noted as a layered strategy, if I may, but with pertussis and other respiratory diseases being droplets as the mode of transmission, wearing a mask is definitely something that can help prevent the spread of pertussis as well. And then we have our post exposure antimicrobial prophylaxis. And this is normally given to household contacts with a confirmed case of pertussis, people that are at a higher risk of developing severe pertussis infection, as well as those who have come in contact with people at higher risk of developing severe pertussis infection. So I wanted to shift the gears a little bit and talk about what we've been seeing within our community in regards to pneumonia. So there has been increases of pneumonia in suburban Cook County, all of parts of Illinois and several other states have seen a rise in myoplasma pneumonia, and this is commonly known as walking pneumonia. And this occurrence have been occurring among school-age children. Myoplasma pneumonia is a type of atypical pneumonia caused by a bacterial infection in the respiratory tract. Although it is typically mild, it can be severe and requires antibody treatment. It is important to note, and let me take a moment to stress this, that pneumonia is not considered a reportable disease, meaning you do not have to report cases of pneumonia to the local health department. But let me tell you, we really do appreciate you communicating with us and keeping us aware and abreast of all of the illnesses affecting your school. It really reminds me of a motto that I love: see something, say something. And because of that, CDC has put out a alert, if I may, to keep people aware of what everyone have been seeing nationally in regards to pneumonia. And let me tell you, again, as I noted, we have been seeing increasing cases across different states and school childhood aged children. So because of this you and CDC's information, it has allowed us, meaning Cook County Department of Public Health, to take a step back and really assess the situation as best as we can and track, if I may, even though it's not reportable, like what does that look like to our community and what strategies could we put out to continue to promote prevention. So I would love to share with you this slide before you that is data from Essence, which is a syndromic surveillance data platform. And this platform monitors real-time emergency department trends. So what you have before you is suburban Cook County data for individuals that have been hospitalized with pneumonia and the ED visits between children between the ages of 5 to 17 years of age. I do want to point out just a couple things. If we're moving this axle along the 7-day average, here are the amount of cases that we have had today in regards to, again, the average. But if we're looking down here at the bottom, if you're following my cursor, this 32 is actually starting with months. So this would put us here in August. And now currently the 40 week will be where we are currently in October, the second week or so of October data is what we have in front of us. Also, I want to point out, if you look at the data trends and data sets that we have here before you, 2018, 2019, 2020, 23, and 2024. It is definitely noted that 2020, 21, and 22 is missing because that is during our pandemic time, and we did not collect data on pneumonias and ED visits. So with that being said, I do want to draw your attention to 2023. this would be last year as we're comparing data. If you look at this all the way, even from August, and follow this cursor all the way through, you would see here that in 2023 and 2018, it was similar in cases during this time in October. Look where we are today, guys. We are here. We are elevated and we're seeing an upward bound movement towards our pneumonia cases for suburban Cook County. And as you see this little curve, this little line going here, the graph is just going up and up and up. So that's letting us know that our data that we will be collecting in the next week or two would definitely be more and more elevated in regards to what we're seeing in regards to pneumonia. It is also just important to note that um, this data here is stratified for the age group of 5 to 17, which is our school age adolescent children. But we also do have more data if anyone is interested in breaking down the chart a little bit farther, say like 5 to 9 years old or 11 to 17. You can just put in a request and I'll be more than happy to share those graphs with you as well. So as we talk about myoplasma pneumonia, just a couple things to note. It is transmitted through the spread of respiratory droplets from coughing and sneezing, and other people can get infected as they breathe in those droplets. So technically what that is meaning, in essence, that you're more likely to get pneumonia and like any other situation with respiratory illnesses as if you're in close proximity for extended periods of time. Like say if it's a household member that has pneumonia and you're in that shared space, you're more often and susceptible to contracting pneumonia, myoplasma, I should say. And then, of course, with the coughing and the sneezing, there is no vaccine to prevent myoplasma pneumonia. So it is recommended that we continue to practice hand hygiene, making sure we're washing those hands frequently, but also covering those coughs and those sneezes. I would be remiss to not mention that it's very imperative if we're coughing and sneezing, we're doing so in the elbows, not the hands. And also that if we are having those sneezes, that we are disposing of those Kleenex immediately. So this all aligns with practicing good respiratory hygiene, and that is considered the core preventive strategy to lower your risk of myoplasma pneumonia, but also other type of respiratory illnesses. We, can't take for granted that the fact that we are in respiratory season and we have to practice good respiratory hygiene along with being vaccinated to give us the best benefit to make sure that we are making sure that we are preventing such illnesses from occurring. So this is a slide that I stated that I would like to have standard moving forward. It is the guidance to the most current school information on preventing the transmission of infections in K to 12 schools. This is CDC information. And what I really want to do is keep this here for you guys to have readily available access to the links, but also as new content becomes available and relevant, I will update this slide accordingly. But I do want to bring your attention to bullet point number 3 here, because oftentimes we are receiving emails and calls through our unit saying we're seeing such elevated cases of pertussis, influenza, COVID, or whatever it may be. What can we do? Like, what more could we do? This link provides you with information on the layered strategies that you can implement within your school. As I mentioned to before, one of those layered strategies could be masking within the schools and, cleaning and excessive cleaning and it just provides a wealth of information that you can use from a layer prevention perspective. So with that, I do want to close by always letting you know that our unit is available with any questions or concerns that you may have this school year. Our email address is presented here for you. We do our best to get back to you in a timely manner. And once you submit these requests, we normally get back to you within 24 hours of normal business operations. So please don't hesitate to reach out to our BPD team with any questions that you may have. And thank you so very much for your time. Thank you for everything that you do. I have talked to many of you, and my staff have talked to many of you, and we know that this is frustrating and there's case after case after case, but we couldn't do this without you. So we are very appreciative of you keeping us in the loop on things, and we're being able to be here as a resource for you. So cheers to a healthier 2024-25 school year. Thank you.
Thank you, Sheila, for that informative presentation. Michelle and Sheila, as you're on, if you're staying on, if you can please go through the chat and answer any questions that pertains to your presentation. We're now going to transition to our next presenter, which is Amy O'Rourke from our Chronic Disease and Prevention. They have some updates, and we'll be sharing screen now for Amy for you to take control.
Oh, Alicia, I still don't see the take control. Would you be able to share your screen? Perfect.
Just let us know when you want us to move to the next slide.
Perfect. Thanks. Hi, everyone. My name is Amy O'Rourke. As Alicia shared, I'm the Director of Chronic Disease Prevention and Control at Cook County Department of Public Health. And we're happy to be here with you to provide some updates on information you all should know about some resources. So we're going to start with a focus on our Cook County Department of Public Health asthma and allergy resources for suburban Cook County schools. So my colleague Keith Wynn was on last month's call, and we provided an overview that we updated our school request process for undesignated medication, both epinephrine and asthma, prescription and standing orders, to make it more efficient for school nurses and schools requesting these resources. So we do have, you can advance to the next slide. We do have a new web page. It's hyperlinked here, and I'll drop it in the chat as well. This has a list of additional resources and background information to support with your request. We also have a new online request form. We ask all schools, as a reminder, to complete this new request form. There's no need to submit additional forms or paperwork via email any longer. Again, we're asking you to use this new online request form, and we will respond within 7 days. When schools do submit a request, you get an auto reply and an option to save your request. And then, like I said, we would be able to share. I'm seeing some items in the chat that individuals cannot see the slides right now. I know I see them. I'm not sure if others see them.
Okay,
But
we will stop sharing and then reshare. But Amy, if you
perfect.
can proceed, I'll have to stop reshare.
Awesome. Thank you so much. And then one other piece that I wanted to provide an update on. In years past, you were contacting us via the Healthy Cook email address. We're asking you to use this new email address, which is shown on the screen, CCDPH undesignated medication at cookcountyyhs.org, as an opportunity to streamline questions or inquiries about this program specifically. Some of the emails were coming to Healthy Cook, and it was hard for us to track and respond for this program specifically. So again, moving forward, we're asking all schools that are requesting prescriptions or standing orders for undesignated medications. That includes epinephrine and asthma for those that are not participating in the Illinois Rescue Program, to complete our online form that is hyperlinked and submit any inquiry or question or issue to our new email address. I want to also provide a reminder that this process provides a prescription and standing order for schools to purchase and access these medications. We're not providing these medications, but we will have our colleagues on from Respiratory Health Association on shortly to speak to the Illinois Rescue Program that many of your schools are probably participating in, that provides access to asthma emergency medication. Okay, next slide, please. Just briefly, a reminder that schools that have been invited to participate in the Illinois Youth Tobacco Survey, we ask that you do participate. Schools were selected, 150 schools across the state of Illinois, with some schools, a handful of schools selected from suburban Cook County. If you were a school that was selected to participate in this survey, we invite you, we request for you to participate. This survey collects important information about trends and nuances of youth tobacco use at the county and state levels, and we use this information to help shape our public health policies and programs aimed at reducing tobacco use and improving health for young people that we all serve. Each participating school will receive $1,000, and then there is a contact information here if you have any questions. We'll drop that in the chat as well when I'm done speaking. So again, if your school was selected, please ensure that you're completing the survey. And then finally, next slide, Illinois has taken a critical first step in ensuring our school children are hunger-free, healthy, and able to learn. And this was done by passing the Healthy Schools Meals for All law that was amended last year, was approved and amended last year in 2023. This amends the previous Illinois free lunch and breakfast statute. But now it's time for this program to be funded. While the law was amended, we now need to find the dollars to fund this program. What this program will provide is free breakfast and lunch for all school children across the state. You have an opportunity to raise your voice, lift your voice to make this request. There is an upcoming ISB, Illinois State Board of Education, finance hearing taking place on budget hearing, taking place on October 28th. It's a virtual meeting from 1 to 4. You can provide written testimony, or you can sign up to provide oral testimony during the meeting. And again, this is a unique opportunity for us to speak on behalf of the schools and students that we serve and ensure access to healthy, nutritious food throughout the school day. We're encouraging you to participate, but please also share this information with others in your network. If any of you are interested in learning more or receiving access to a template testimony that you can tailor for your unique school environment, feel free to drop your name and email in the chat, and I'm happy to follow up with you via email to share those resources. And with that, then I'm going to turn it over to my colleague with Respiratory Health Association to speak to you all about the Rescue Illinois program and some updates for suburban Cook County.
Thanks, Amy. My take control went away, but I have sharing authority, so I don't know. Can you see my slides?
We can. Go ahead. Go ahead.
All right. Okay. My name's Erica Salem. I am the Senior Director of Strategies, Programs, and Policy for Respiratory Health Association. For the last 2 years, we have been partnering with Asthma Allergy Foundation, Mid-States chapters, to support implementation of the Rescue Illinois Schools program, which provides undesignated asthma medication and resources to Illinois schools to be used in cases of emergency. So I want to briefly give you an update on year 1 across the state. There were 3,100, 3,200 almost schools that were eligible with the funding we had, and 68% of them enrolled formally in the program. During the school year, there were 657 student asthma emergencies reported through the program portal, and they came from 279 schools from 138 districts and 43 counties. So we can see Cook County up somewhere in this mess. 167 reports came from suburban Cook County. That's 25% of the total incidents reported last school year. This is specific to the Cook County students. Half attended elementary school, half were attending a school that included elementary and middle school. 10 years old was the average age, and the majority or the greatest proportion of students were Black and then Latino. 65% had a diagnosis on file with their school. 53% were triggered by physical activity, and at least 17% had more than one incident reported through the program portal. The outcomes among Cook County students, I'm really excited about this program, and this is why. 78% of the students that had an emergency were able to return to class after the treatment. 21% or 33 students went home, and 0 ended up needing to go to the emergency room. Statewide, there were 11 that had to go to the emergency room. In the reporting portal, nurses are asked, if this program hadn't been available, what do you think would have happened? And this is what they estimated. Only 9% would have gone back to class. 29 students would have ended up going to the emergency room, and 10% of those students, so that's actually, and 10% or additional 16 might have gone to the emergency room. So we know this program is keeping kids in class, keeping them out of the healthcare system, and we're counting this as a big success. Our plans for year 2, there was an increase in funding, so all public schools will now be eligible. My goal is for state-approved parochial schools and private schools to be eligible as well. Definitely would like to see greater focus on getting asthma action plans submitted and encouraging families to bring their inhalers. A lot of the students across the state that had emergencies either had forgotten an inhaler at home or had an inhaler that was expired or out of medication, or didn't have the resources to have a second inhaler for school. In terms of the timeline for this year, the state has approved the detailed budget submitted by the Asthma Allergy Foundation, and what we are waiting for is the contract to be finalized. I did speak with Asthma Allergy Foundation this morning, and unfortunately they think this is going to be closer to November, later in November, that the materials will start shipping out to schools. And that is my update on the program.
Thank you so much, Erica. We appreciate you sharing. For all my speakers, please check the chat. There may be some questions specific to your presentation. And then now we're going to turn it over to our nursing department. We have Miaka Streeter, who will be providing an update on our nursing program and services.
All right. Hi, good afternoon, everyone. Thank you all for the invite, and thank you all for the information. because it's good to know, because we have been assisting and managing the Healthy Cook email. So now I know who my go-to people are. All right, so the updates with the nursing department. As of September of this year, we restarted the hearing and vision screening program for the preschool. And the preschool ages are 3 to 5 years of age. We're providing services to the suburban areas of Cook County for both public, private, and the parochial schools. We have I'll share in the chat the website where we're asking that the schools complete the application. As of today, we have received 41 applications. We have screened about close to 450 children of 3 to 5 years of age for both hearing and vision. Also with the program, if there is a referral, we see there is a referral that's necessary, we will assist the parent with providing the resources that we pretty much communicate with to get the child the services that they need. So with the program, we just identify, we test the evaluation and initiation of the follow-up services. All the services that are provided is by Illinois Department of Public Health Service certified technician. Our plans is to increase it to the other school age children, but as of now, we're just starting with the preschool. It's a restart of the program. All right, that's it.
Thank you so much, Mimi, for your update. Again, if there are question speakers, please go ahead in the chat and answer those questions. We will have, if time allotted, question and answer at the end. I am going to turn it over to our friends from Birth to Five. 1 second. And Jaime, are you presenting? Perfect. I'll start sharing so you can bring up your screen.
Great, thank you. Can you see my screen?
Yes, we can.
All right. Well, thank you guys so much for giving us this platform. We will be mindful of your time, so we're going to move this like a machine. Feel free to drop questions in the chat. We're going to supply you with some links to various things that will familiarize you with Birth to Five Illinois. So if you can hit your raise hand function, or if you're on camera, by a show of hands, how many people are familiar with Birth to Five Illinois? I see 1, 2. Great. So some have heard of our work. Not as many as we would like, but that's okay, because you're going to hear about it today, right? All right, a couple of hands, perfect. So my name is Ashanti Jackson. I am the Regional Council Manager with Birth to Five Illinois. We service Region 1BC, which is Cook County South. So our region services the full South suburban area, and we'll show you what that looks like in a minute. Go back to the next slide. And then we have our team here. Team, if you're going to come off mute really quick and just quickly introduce yourselves.
Good afternoon, everyone, and thank you for having us here. My name is Jaime Garibay, and I am the Family and Community Engagement Specialist.
Good afternoon, everyone. My name is Leah Armour. I'm the Regional Administrative Support. Thank you so much for having us.
Thank you. All right, so Region 1BC. So Birth to Five Illinois has 39 regional offices. Each one really represents a county or multiple counties of the state of Illinois, and there's a reason behind that. Let's move to the next slide. So this is our service area. So many of you are familiar and working already, or maybe even live in some of these towns that are listed. This is not the best map to show our area, but it's the only one that I could find. So we do service all the way to the Indiana state line. We go as far south as the Will County border, and then we go as far west as Lamont, and everything bordering that south side of city of Chicago. Next slide, please. So Birth to Five Illinois. Illinois had a goal of becoming the best state in the nation for families to raise young children by improving and expanding the delivery of child care and early learning programs for children from birth until they start kindergarten. In 2019, the governor established an early childhood funding commission charged with studying and making recommendations on funding goals and funding mechanisms that provide equitable access to high quality early childhood education and care services for all children from birth to age 5. This resulting report, and it also has a companion report as well, set a level of recommendations to ensure that all families in Illinois, regardless of race, ethnicity, home language, ability, and social circumstance, have services that they need to be prepared for school and thrive in a school environment. So these are just some highlights of what I just read here. This is kind of what developed Birth to Five Illinois' work, and this is what the thought process and initiative is that really put our organization together. Next slide, please. So here you just see a lovely visual of both of those reports and some key recommendations. One was the commission's articulated long-term ECEC funding goal in policy making to centralize ECEC funding systems and distribute funding in new ways, and centralize Illinois' ECEC systems in one newly founded state agency. So two of those things are really coming to fruition now. And in your roles every day working in schools and community, you probably see funding coming from various different places for various programs that you may be supporting. So now we're seeing that funding become more streamlined. And then we also see the development of the new Office of Early Childhood Education coming into formulation. So the commission grounded its work in a few values, making sure that education is a public priority, to ensure equity, to embrace bold system changes, to build upon the solid foundation, to prioritize the perspectives of families and caregivers and stakeholders, and design and have a sustainable system that will support families. Next slide, please.
What is Birth to Five Illinois? Birth to Five Illinois was created to help bridge the gaps between families, caregivers, early childhood providers, and decision makers. We rely on quantitative data collected from state, local, and private agencies and organizations, and qualitative data collected from families, caregivers, providers, and stakeholders to form recommendations that will make ECEC services and supports more equitable for all children and families in the state. Birth to Five Illinois was founded in September 2021, and work began with opening regional offices in summer of 2022. Next slide, please. Our mission. Our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high-quality early childhood services for all children and families in the state of Illinois. Next slide, please. What our vision is. Our vision is reimagining a more equitable early childhood education and care ECEC system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision making in Illinois. Next slide. Our values and goals. Our values and goals, family voice. Through this transformation centered at authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care ECEC system. Racial equity, to move our early childhood education and care ECEC system to one where racism no longer impacts a child's success. We will work to dismantle barriers that have limited access to high quality service for minoritized children in every corner of our state. Collective impact. Birth to Five Illinois will build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and or expanded services are created to meet community needs. This community-driven framework will directly influence policy funding at the local, regional, and state level. Next slide, Jaime. Our culture statement. Birth to Five Illinois is committed to nurturing a community of leaders and learners actively engaged in creating an environment that supports and reflects culturally responsive practices. Centering equity is at the core of everything we do. We reflect, intentionally engage, and honor the diversity of each person. We value the celebration of accomplishment and work-life well-being. Racial equity definition. Racial equity is achieved when an individual's racial ethnic identity does not determine their life trajectory. Racial equity results from long-standing and present-day embedded systemic practices and policies, not the ability of the individual or oppressed racial ethnic group. Eradicating racial inequities requires intentional and bold efforts to address not only individual biases, but also systems and policies.
And you may ask yourself, how do we do this? We do not do the work ourselves. We do not provide direct services. Each region across the state has two councils. One is the Action Council, which is comprised of family members, caregivers, early childhood professionals, different stakeholders in the community, right? And we also have the Family Council, which is family caregivers of children under the age of 8. We do this just to safeguard the confidentiality and integrity of the family so families are able to share their information freely, privately, and we put the reports together. So what we've done, right? Year one, we launched the Family Action Councils. We completed and published an early childhood regional needs assessment. During year two, as we were trying to finish up this early childhood regional needs assessments, we were also working on the mental and behavioral health needs assessment that we created across the region. At the same time, we're working on creating action plans with the councils. All these reports, let me drop them into the chat one second. These reports can be found in our website, so please feel free to go over them. Again, this is not something that we put it together for the families, for the communities, but we didn't do it ourselves. This is what the communities are saying they need. So as part of year three, we need to move the needle to making those action plans possible. And reaching out the farthest sides of each community that has not been addressed, right? And talk to them and make sure they are represented and they're centered at the table. So the scope of work for year three, again, is share the regional needs assessment, share the reports that we have in there, the action plan, the mental and behavioral health needs assessment, continue updating our action plan. We are in the process of updating this. So again, we're looking for community partners as well as meeting with us and helping move this work forward, or just collaborating with us somehow at different capacities. So it doesn't have to be one specific way. Continue building relationships and supporting the needs of the families in every community.
All right. So thank you guys so much for sharing that. So these are our three regional reports that we've put together over the last 3 years. We have the early childhood regional needs assessment. From there, we did the action plans, which kind of talks about the scope of work that we would like to see realized in community. And then we did a focus on mental and behavioral health. So we do want to highlight our focus on mental and behavioral health here for you guys today. So next slide, please. Mental and behavioral health was something that we heard throughout the state in all 39 regions. And the feedback that we received was that we need more supports. And with the governor's Smart Start initiative, we're really trying to drill down on what supports are needed at the regional level and how we can solidify those supports and really make tangible things come into fruition. Next slide. So early childhood mental and behavioral health regional landscape. As mentioned, regional teams and council members discuss the overall mental and behavioral health landscape to understand better what is available to families and ECEC professionals in the region. While services for young children may be available in our region, not all families have access to them. And I'm sure that in your prospective organizations and schools, you are noticing that as well. While there are services, not everyone can access those services. 61% of people surveyed across the state said they waited 2 or more months to gain services or after receiving a referral. And then 11% said they were unable to get services for their child at all. 37% of those surveys said they had to travel over 30 minutes for services. And we also know that transportation, especially in this region, can be an issue. If you are relying on public transportation, it's really not effective for you to make appointments and keep the services that you need. Most regional referrals come from pediatricians, early interventionists, or school programs such as yourselves.
Parent and caregiver experiences. Eventually, we located a single doctor in a different region who can conduct the evaluation. However, this practitioner gave me an evaluation, the parent to administer to my child, resulting in a considerable waste of time. To find a suitable provider, we had to switch insurance companies. It took a year before we could finally access the necessary support for our child. Find a community meter.
All right. So infant, early childhood mental health consultants. This is just some information that we collected from the surveys that we did. So consultants provide training and support for ECEC professionals who work directly with young children. Programs do not receive a direct referral for mental and behavioral health services. Instead, they support the parent and child relationship by facilitating group connections, encouraging healthy growth and development, and promoting safety and family well-being. So I heard that there may be some childcare providers, centers online. So you guys may be familiar with the Infant and Early Childhood Mental Health Consultants Program. And then council and community members also shared that staff shortages, lack of funding, and lack of awareness are also reasons that some ECEC programs do not use this service. Next slide.
Parent and caregiver experiences. As providers, we do not have the same resources as the CBOs, community-based organizations, or school districts. Find a family child care provider. I was not aware that IECMH consultants were available for providers. Find another family child care provider.
Home visiting. So there are several home visiting programs in Illinois that support expectant families and caregivers with newborns. These programs aim to support people with experiences, conditions that can lead to harmful health, educational, and social outcomes. While services for children may be available in the region, not all families can access them. So again, we are experiencing an access issue in Cook County South. Services are offered virtually, but then we do have a technology inequality that kind of comes into that as well. Some of the prevention initiative program sites in Region 1BC do offer home visiting, but we weren't actually able to get correct numbers to really survey what that structure is like. There is the Baby Talk program, which is an engagement model, provides framework for some home visitors within the region. There is a significant uptick in individualized family services plans in the state and in the region. Many regional service coordinators, have a caseload of 80 to 100 cases, when it's ideal to have about 20 to 30 cases. Next slide.
Parent and caregiver experiences. Home visiting service made a significant difference for my child, especially considering that his first 2 years coincided with the COVID-19 pandemic. Without home visiting, he would have limited socialization opportunities outside our family circle. Another community member.
All right, and so when we look at the mental and behavioral health landscape, these are some of the regional needs. Improving access to mental and behavioral health services, culturally competent services and resources sensitive to families' diverse backgrounds and needs, services that might meet the needs of families, more training opportunities, and then mental and behavioral health services. Next slide. Some key takeaways as we dived into really the mental and behavioral health landscape. Advocacy is going to be crucial in advancing this work. Our families are dealing with barriers, not only barriers of access and transportation, but there's the stigma barriers. There are some financial constraints that families are really having difficulty with accessing mental and behavioral health services. It's going to be important that we collaborate and we have participation from all stakeholders diverse within the region to improve mental and behavioral health outcomes. There's a pressing need for increased awareness and education, and the importance of mental and behavioral health in early childhood services really needs to be recognized and developed from a holistic approach. Next slide. Oh, we should be on the key takeaway. Did we miss a slide? Oops. Okay, so maybe that's the one I just read. Yep, okay, yep. So this is the space that we do have for questions, but I know that questions are in the chat. So if you do want to ask us any questions, feel free to do so. This is our QR code and information. So if you wanted to stay in touch, we have added all the links here to our reports, as well as we'll drop our contact information if you wanted to have some more context or conversation. We ask you to support us in our work. And if you want to connect, please feel free to do so. But thank you, guys.
Thank you so much, Birth to Five. So this brings us to the end of our meeting. I want to thank everyone for joining us and staying on. We know we went a little bit over, but we had a host of great information from our partners and friends. So we want to be sure to share this information with you. Just some things as we're closing out. First, just thank you to all of our speakers, Sheila from our communicable disease unit, Amy from our chronic disease and prevention, Erica from RHA, Ashanti, Jaime, and Leah from Birth to Five. So thank you all for coming and sharing that information. And I'm sorry, I forgot Miyako from nursing. So the school health meeting topic survey. So how do we know what speakers to bring, what resources to share? We get this from our school health advisory council meetings where we come together to talk about resources and things that's needed throughout these meetings. But also another opportunity is through this survey. So please be sure it's going to be open until November 30th. Our next meeting will be Friday, November 15th at 2 p.m. Please remember on the new platform, although it looked virtually the same, we're using the webinar function versus the Teams meeting. So each meeting you will have to register for. So please ensure you're registered. That meeting link is in this PowerPoint and still will be emailed to you all as well. There will be no meeting December. You're going to receive the newsletter. And then as always, you'll receive an email from Stacy with the slide deck and access to this meeting recording so you can have access to all of the resources. Thank you all so much, and you guys have a safe and enjoyable weekend.
Thank you.
Bye.
Thank you.